With Fulvio,
Yep.
we discussed a procedure where the chest, so this is another male chest procedure.
There's been a run of these lately.
There has, yeah. We discussed where the chest skin is lifted by stitching it up and then removing the stitches a few days after. Could you kindly let me know what this procedure is called?
You mean an Auersvald net?
I do mean an Auersvald net.
Not an Auersvald.
Owl.
An Auersvald hemostatic net.
Auersvald steamer.
It's Auersvald. Auersvald hemostatic net. It's been called, actually, different people have called them different things, actually, but I think most of us accept an Auersvald net. So it started off, actually...
You won't have seen this. It's the weirdest thing. It looks absolutely bizarre.
It looks a bit horror movie. This is quite a dark fob club, isn't it?
Yeah.
It looks a bit horror movie. So
it looks like a fishing net on the skin.
Through your face. Or,
on your skin.
Or
some
chest
on your,
or,
they do it on the face during a facelift.
Yeah.
They do it on the chest during a...
So, started...
Grabbing myself there on...
You are, aren't you?
Sorry.
We'll save that for later. So, an Auersvald hemostatic net started off in facelifts. So, a hematoma in a facelift is a disaster. You don't want a hematoma in a facelift. So, when you've lifted up everything and you've sort of put it all back, you want to take tension off the scars and you want to close the dead space. Dead space is the space between where you've lifted up and put it down, but there's still this potential space, and if it bled in there, it wouldn't take much to lift it off. So you want to close that and make sure it does take much to lift it off. So what surgeons started doing, specifically this dude called Auersvald, which is why it got named an Auersvald hemostatic net, is would start putting stitches, deep quilting stitches in. And so these stitches would go through the skin, would catch a deep layer, come out again, tie a knot, and then you just keep running it. So you just go through the skin again and out, and through the skin again and out. So you get these little loops of stitch everywhere.
So again, I'm going to do the layman's explanation. You know those kids' toys where they're like stress toys and there's like a squishy toy in a net?
Yeah.
And you squish it and then the jelly stuff comes between the net. That's what it looks like.
That is what it looks like. I'm going to say it's like a Chesterfield sofa, which has been sort of stuck down.
No, it doesn't. It looks like
It doesn't look like that.
Kid's squishy toy.
It does look like that, but the effect is kind of you want to spot weld the skin down in various places. So it was first of all started off, it originated as a way of closing the dead space. And then surgeons found that they were actually able to pull the skin where they wanted it to be and hold it there by using this Auersvald net. And so it moved on from the face, not too far, to the forehead. And surgeons, forehead lifts are a bit of a bugger of an operation in some ways, and actually you can turn it into a really easy operation. All you do, little cut up there, undermine. Undermine means separate the skin from...
Like when you're taking the chicken breast off a chicken.
Right. Put your finger in and wiggle. Yeah. And you can do that, and then you pull up, and obviously if you just pull up, then you let go and it will fall down. So short of following the patient around for the next week or two doing this, because that will get talked about, what you can then do is put your Auersvald hemostatic net there and hold the skin there. Now what is helpful, what is interesting, is that if you hold the skin in that new position relative to the deep structures and you hold it there for a few days, your own body will glue it back down in that location, and that's where it's stuck forever. So you're changing the relationship between the skin and the deep structure, so you can use it to sort of create a brow lift. Now suddenly surgeons got wind of this and thought, this is awesome. The number of times I want to change the relationship between the skin and the deep tissue, that's basically all we do. So everyone started using it absolutely everywhere, both to close dead space, to reduce the risk of hematomas, to be able to go drainless, and to change the relationship of skin. So, back to that question. Can you just remind me what the question was?
What's the name of this procedure?
Okay, well, it's an Auersvald hemostatic net, and what I'm doing with a male chest reduction in that context is, look, guys don't want great big scars on their chest. Women don't either, but at least with a female breast, you can hide it. You can hide it in the crease, you can hide it around the nipple. You don't have this option in male chests. And also, men don't hide their chests under bras. If they're going to go shirtless, they're going to go top off. So you want to go as below the radar as possible with a male chest, as possible. And so the operations we used to do, and these should really just be in the history books, where we'd go like a female breast reduction or a breast lift around the nipple, vertically downwards and in the crease, should never happen, I don't believe, on a male chest. That's that is not cool. What I'll try and do wherever possible is try to liposuction as much away as possible. Sometimes you need to open around the nipple, but just a small amount, just to take out the actual breast tissue, the breast gland, just under the nipple in a man's breast, in a man's chest. And then that's great, that debulks it, but the skin will just want to hang off because it had all this volume in it now, and now you've emptied it, it's just going to want to hang. So what you can do is put that skin exactly where you want it and use this Auersvald hemostatic net to hold it in place. Problem with that is, if you've got a stitch that comes through the skin and stays there for longer than about a week, it will create permanent stitch marks. And in this case, there's a hell of a lot of them, they're everywhere. So I tend to get the patients back in 3, 4, 5 days or so, get all of those stitches taken out. But by that time, the skin has stuck down where you want it. So that's the plan. So you haven't removed the skin, but you've just sort of redistributed it over a different area, and it works, it's fine. The only place you don't want the excess skin is hanging off the bottom of the chest. But if it's just sort of spread around the whole area, it's fine. That's okay. All right then.